How do diverse breathing techniques aid cystic fibrosis airway clearance? Imagine your lungs are like a busy city with narrow streets clogged by thick, sticky traffic. For people with cystic fibrosis, that traffic is mucus that builds up and blocks the airways. This mucus can cause infections, inflammation, and make breathing harder over time. To keep the airways clear and healthy, various breathing techniques are used to help loosen and remove this mucus safely and effectively. These techniques work by using controlled breathing patterns that help move mucus from the smaller, harder-to-reach airways to the larger airways where it can be coughed or huffed out. Think of it as guiding the traffic to the main roads for easy removal. Regular use of these methods can prevent mucus buildup, lower the risk of infections, and help maintain lung function. One common technique is the active cycle of breathing. It combines gentle breathing to relax the airways, deep breaths to expand the lungs, and forceful exhalations called huffs to clear mucus from larger airways. This cycle is often repeated several times a day and can be tailored to each person's needs. Another effective method is autogenic drainage. It involves 3 phases of controlled breathing at different lung volumes. First, slow, deep breaths help loosen mucus in the small airways. Next, mid-range breaths move mucus to the middle-sized airways. Finally, deep breaths and breath holds bring the mucus to the central airways, where it can be expelled with a huff. This technique requires careful control to avoid airway collapse and is usually taught by respiratory therapists. Positive expiratory pressure therapy uses a device that creates resistance during exhalation. This resistance helps keep the airways open longer and pushes air behind the mucus, helping to loosen it. Oscillating positive expiratory pressure devices add vibrations during exhalation, which further help loosen mucus from the airway walls. High-frequency chest wall oscillation, often called the vest, is a machine that vibrates the chest externally at high frequencies. These vibrations thin and loosen mucus, making it easier to clear through coughing or huffing. This device is worn over the chest for about 20 to 30 minutes, usually multiple times a day, and is often used alongside other airway clearance methods. The science behind these techniques is based on airflow dynamics and mechanical forces that dislodge thick mucus, prevent airway narrowing, and promote mucus transport. It's important that breathing exercises are performed regularly and correctly to be most effective. They are often personalized and taught by specialized respiratory therapists or physiotherapists to ensure safety and maximum benefit. Using these diverse breathing techniques helps keep the airways clear, reduces infections, and preserves lung function. They are a vital part of managing cystic fibrosis and improving quality of life. Remember, each person's experience is unique, so it's essential to work closely with healthcare professionals to develop a tailored plan. If you or someone you know has cystic fibrosis, always consult your medical team before starting any new airway clearance routine to ensure it fits your specific needs.